All right, Noah and I decided to record our videos together just to save us time and you time with grading as well. Um, uh, with the exception of the hands-on techniques where we'll have to alternate, we're just going to do the breathing and coughing techniques at the same time. Um, we'll just kind of say which one we're about to do before we show you. We'll start with the breathing techniques. So we'll start with cervical extension. So as you breathe in, go into cervical extension and then breathe out as you bring your head forward. Got scapular retraction, same thing as you pull your shoulders back, retract your scapulae, breathe in, and then out. Shoulder flexion, so bring your hands overhead, breathe in, out. And then positioning, so this is the stuff that we'll use this table for it.
All right, I'll go first. So this is supine with the towel roll. So what you'll do is get your towel roll, roll it up, probably a little bit better than what I have rolled up. I roll it up. You have your patient lay supine on the table. Doesn't break. And hopefully it doesn't break. And then you have a lay their spine on it so it opens up their chest and hopefully it helps them facilitate their breathing better. So, there we go. And then the next position is towel on the side. Lay on your side. Just like that. And then, so, and good, so he'll do it to me.
Alright, so go ahead and lay down on your back.
Keep my legs off the side.
Okay.
So, yeah.
Alright, go ahead and line that up with your spine. And again, like Noah said, that just helps to open up the thoracic cavity, the thoracic cage a little bit. Do some deep breathing there. And then side lying. And turn it to run in the same direction as the ribs. This will help open up this left side of this rib cage. And then do some deep breathing there. Just help get, a little extra space. Get that opened up a little bit. Get next.
Manual therapy.
Okay. Yeah, we're still confused on that.
Yeah, so. We do know that the manual therapy is used if they have like restrictions to scars or something restricted in their thoracic area that's keeping them from breathing. You can do myofascial releases to help facilitate that. And then there is the rib mobilizations that you can, thoracic vertebrae and rib mobilizations that you can do. We know how to do it when it's not with breathing, but we're kind of muddy on how to do it when it's in accordance with breathing. So like doing it at the same time as they're taking deep breaths in and out. But
yeah, the way we kind of interpreted it was almost like a test-retest approach. So if you notice restrictions or limitations, you could do the myofascial release or the rib mobilizations and then retest to see if they gained any additional range there.
the one rib mobilization that we do think we might be able to do correctly, but obviously you can just let us know if we're not doing it right. We can just get it closer right here. So you just sit with your back facing,
My back.
yeah, back facing that way. So like the way we think you can do it is find the rib that's not moving. So once you get it, have them take a deep breath in. You can help push up. And then when you're going, help push back down. But other than that, we really don't know. So Would like some help with that?
Diagonal lifting PNF pattern. So start down here and then just follow that PNF pattern. Breathe in, breathe out, breathe in, breathe out. Positioning to enhance breathing can go prone on elbows, sitting upright or standing, or tripod position. So prone on elbows. I guess I can just yeah, just do it on here. Pretty self-explanatory position. So prone on elbows, but that'll help open up that thoracic cage a little bit, the thoracic cavity. Just chill in this position for a little bit. Do some breathing. And then
I'm gonna do mine down here.
with that one, I was a little confused. I know with the coughing, as you inhale, you cough and flex your cervical spine at the same time, but I wasn't sure with the breathing if we do the same thing or if we just kind of hang out in this position and do that. So if you could provide some clarification on that, that'd be nice. What do we have next? We had the sitting upright or standing.
Yeah.
Just getting that upright posture and standing will help open up.
Correct posture.
Um,
Correct upright posture.
yeah.
So either sitting, standing. So shoulders back,
Yeah.
head back.
That one's pretty self-explanatory. I feel like the tripod position.
Tripod position. Sit down. Have your hands on your legs. Helps you use your accessory muscles when you're breathing. So
Just as he said.
butterfly technique.
Butterfly, that's done in sitting as well. Hands behind your head. As you breathe in, you're going to pull your elbows back. And then exhale and bring your elbows forward.
Lower costal breathing.
Uh,
Lower costal breathing. You can have them lay on their back to begin with. You can this is kind of like the progression where you start supine and then you go up to sitting upright and then standing, but it's trying to get them to use their lower costals, use the musculature down there to help breathe more deep breathing instead of up here in their upper thoracic. So way you can do it is I'll place my one hand on his chest, another one on his lower intercostals, and I'll tell him I want you to keep my hand that's on his chest still, and I want him to move this hand up and down. So
I don't even know if I'm doing it.
you're kind of doing it. Well, that's one way to do it. To help them do it at home, you can put a Kleenex box there and have them try to raise that Kleenex box to the ceiling. So that's one way to do it. And then just work this, and then he'll do it to me. This table's not gonna make it. Ah, there we go.
Alright. So as he said, one hand on the upper chest, one down at the lower costal area. And then just explain, I want you to try to raise my left hand with you as you breathe in, but try to keep this one in the same spot. Okay, he's doing it pretty well. And on their own can use a Kleenex box. Let's see what else you have.
And you could do it.
And then,
you progress to sitting, then standing, doing the same thing, just trying to get that lower area to go out.
Yeah, and to facilitate it, you can, as they inhale, apply some pressure to the lateral sides of the lower costals to kind of resist that bucket handle movement a little bit. So just as they're inhaling, apply that pressure to their ribs. They can do it on their own, which is why we're just doing it on ourselves rather than on each other. And then, like you said, you can do that in supine, upright sitting or standing. And then exhalation, you got pursed lip breathing. Just purse your lips and exhale.
Like you're blowing off some soup.
Yeah. Can't remember the exact mechanism for it, but it helps them get a little bit of that extra air out if they're having trouble exhaling. And then exhale with effort. This one we were kind of confused about too.
But we think we got it.
Yeah.
So,
You wanted to- So you said in the audio portion of it to kind of count the repetitions. We thought like exhale with effort, that was kind of like a forced expiration.
one.
Like that, and then breathe or count it after each time you exhale like that. And we weren't sure if it was just like as you're counting, like you have to breathe out as you're saying the numbers, so we didn't know what exactly that was, but we think it's that kind of forced expiration. So
One.
if you could provide some clarification on that as well. Yeah. And then paced breathing.
That is,
That's just with walking, right?
yeah, walking. Walk,
Yeah.
you inhale with 2-step. You inhale for a 2 count on while you walk and exhale for a 4 count. So
Yeah, and that's just to make sure you're getting that right ratio of inhalation to expiration, or exhalation, that 1-to-2 ratio. So running out of space, but then I think that's it for the breathing. So the coughing.
the normal
and- well, this might not work because my laptop's about to die on me.
your laptop's about to die.
Yeah, I think it has a virus.
No, nice.
So this will keep popping up until
Well, demonstrating the components of a normal cough. It's a deep breath.
We're just gonna use yours.
Okay, sounds good.
Okay.
Deep breath, hold it, and then force the air out in a cough. Using your abdomens to help you force it out. So make sure that when you're holding it, it helps close the glottis to allow you to cough.
Huff coughing. We do not have any tissues down here, but you can use this to make sure you're exhaling strongly enough. So what that is basically what Noah just did.
You can do it slowly like that, or you can do it nice and quick like.
Yeah, and the quicker ones are for the more proximal airways to clear those out, and then the longer holds are for the more peripheral airways down in the lungs. So that would be for more peripheral ones, and then would be for the more proximal airways. And then just hold a tissue in front of your face to make sure you'll see the tissue kind of blow if you're getting enough force with that. Coughing techniques, flexed positioning, kind of having your upper body your trunk in a flexed position will help you get some abdominal activation.
You can do this in sitting or standing. Usually sitting helps it a little bit more. So flexing forward while you cough.
Yeah.
Get more force out of it.
Splinted coughing, that's using usually a pillow. These are for patients post-op if they have an incision site. You'll have them hold the pillow with some pressure against that incision, and that'll just help splint to that area if they have some incisional pain there. And then on to breath stacking. You're gonna have them breathe in typically about 3 times, so you'll have them breathe in normally, hold, breathe in again, hold, and then on that third one breathe in and cough at the end of that inhale. So
That was a good one. So
those are coughing techniques.
there's that. So moving on to
The
cough assist. So we'll stay on the floor because if I push down on you, we might break that table.
Yeah.
So there's costophrenic assist. Laying down,
This one's supine.
supine. So I'm gonna provide pressure on the outside, downward and in, creating pressure in there to help facilitate a cough. All right, so ready? 1, 2, 3, cough. Downward and in. You can also do it this way. There we go. Please turn your head to the side so you don't cough in my face, but it's all right.
Hey, I was doing as you
You're
instructed.
right. Yeah, you have your patient cough to the side so they don't cough in your face. This next one's the Heimlich.
Just gave him coronavirus.
Yeah, you probably did. Laid down.
Sideline. Or
We're doing supine still.
Sorry.
We'll do Heimlich. So getting on right underneath here and pushing up to help facilitate it. Yeah, turn your head to the side. So, ready? One more. Alright, now you get to do them to me.
Alright.
I'm not going to cough back into your face because I'm not mean.
Well, I'm gonna instruct you to turn your head before starting,
Oh, you're welcome.
so you don't. Yeah. So just as he said, with the costophrenic, pushing down and in as he coughs, especially towards the end of the cough. So we'll do that one first. Turn your head. I was saying that. That's what I was thinking. Okay. Whenever you're ready. Okay, so provided that down and in force, and then the Heimlich, again, hand right here. This one will be up and in, and then same thing. Turn your head, breathe in, and cough, and then during that cough, especially towards the end, apply that pressure to help him get a little bit more air out. Let's see what else we got. Side lying, again, costophrenic. It's the same motion, just obviously a different position. So I'll have you lay on your right side facing her. So this one, and I might go, for someone bigger like this, I might go with a hand over hand, just so I can get 2, but you can usually just go one hand. Same thing, breathe in, and then cough. And that down and in pressure, kind of going inferiorly and medially, and then Heimlich. So this one, you can do the same, kind of use the palm of your hand, or you can also use a fist if you want. I'm going to go ahead and go with the palm just because I think it's a little more comfortable for the patient. So find that area right there. That up and in. So kind of that direction. Let's see. And then you can do combined. So I would use my left hand. If I'm in this position, I'll use my arm that's closer to his legs for the Heimlich part, and then my arm that's closer to his head for the costophrenic. So right hand on those lower costals on the lateral aspect, and then on the anterior aspect here. So just combining those two motions, the down and in with the costophrenic, and then the up and in with the Heimlich. So combining those together, and then counter rotation assist. So starting with shoulders back, hips forward. He's gonna breathe in, and then as he coughs, I'm gonna push his shoulders forward and pull his hips back. So whenever you're ready, just like that.
Alright, now I'm gonna do all the sideline ones on him. So, Costa Phoretic. Just place my hand right up here, and so you can breathe in, and then I'm gonna push down and in when he coughs. So ready, cough. Good, and then the Heimlich.
Oh, so probably hold it a little bit longer, but
Heimlich. I'm gonna push up right here. Ready.
there you go.
There you go. Next one is the combined one, so I'm pushing down and in while pushing up with the Heimlich. So the lower hand doing the Heimlich, upper one doing the Costa Phoretic. Ready? That, and then the counter rotation. So then
My hand in
I'll
it.
try it again.
Had my hand in an awkward position.
Yeah, keep your hand up there. There you go.
There you go.
And so
That's more me not knowing how to be a patient than him.
All right, so the self cough assist we can do together. So we're prone on elbows.
And then, like I said earlier, with this one, we know with the cough, as they inhale, they'll bring their head back, and then as they cough, they'll throw their head forward. So
And then the next one is the Tetra long sit self assist.
this one was
So you're
yeah.
long sitting, hands back. Again, breathe in like this, and you're gonna cough going forward and throw your head forward. So just like that. The para long sit self assist. You can have your hands up like this to help you throw forward. You can just, or you can just stand regular, but you just throw your body forward like that.
Yeah. So the slide said hands overhead, which I
Yeah, you can
assume means this, so you can throw the arms forward too. But the picture itself,
Yeah.
had kind of the butterfly position. I would think either of them would work.
Yeah.
But if there's a preferred position, just let us know. So
I'd probably just patient. We're just gonna go off what patient comfort is too, what they
Yeah,
works
whatever.
best for them. So. All right, and now the short sitting self assist.
short sitting. No, that's like.
We need
I
this.
think I want to say that one was also butterfly. Oh no, that's Heimlich.
Yeah, you Heimlich yourself.
Yep. Yeah.
You come in. You're gonna just Heimlich yourself while you go down.
Kind of like you're punching yourself in the gut, I guess. I can demonstrate it too. Alright. And then just pulling up and in as I'm coughing.
Last one is counter rotation. So you can do it with one hand or two hands. I think I get a better self assist when I do two hands. So you also do it while sitting as well. So
Um,
and that's
Yeah.
all of them.
yeah, that's all we got. So
If you could answer the questions that we did have during it, we'd be really grateful.
and then just leave comments if we were doing anything incorrectly.
Yeah.
Yeah. I
Thank
feel
you.
like we understand most of them, but like we said, we did have a couple that we wanted some clarification on. So,
Thank you very much.
thanks.